Hey guys, it's Leah B from Prestige Worldwide Medical Consulting. I'm a U.S. Army veteran, physician assistant, and former CMP examiner, compensation and pension examiner. So today I want to come on and discuss radiculopathy and how that relates to VA disability. Many veterans suffer from radiculopathy, and it can come from several different levels of the spine. It can come from the cervical spine, the thoracic spine, it can come from the lumbar spine, and it causes a variety of symptoms, and it can get super confusing. And I want to try to clear up some of the questions that I get asked constantly about this. And maybe this will help, some of you guys understand this a little bit better. So what is radiculopathy? So radiculopathy is a sensation that the symptoms are numbness and pain. It doesn't have to be both, but numbness or pain or tingling that can go in your extremities, your arms or your legs. It can also happen it can actually happen in different parts of your body, like your genital region, in your groin. And it all really relates back to the level of the spine that it's happening at, whether it be your, C2, your C3, your L4, your L5. There's really just a very specific diagram. That shows each nerve root and what part of the body it feeds. Okay. And so how do veterans get service connected for this? So you can be service connected on a primary or a secondary basis. So from a primary standpoint, did you get diagnosed with this on active duty, right? Did you get diagnosed with this on active duty? Um, and did it get to a compensable degree while you were on active duty? Um, did the symptoms start on active duty? Maybe you have a buddy letter and you get rated for it later, or you can be rated for it on a secondary basis to whatever level of the spine that it's coming from, right? So if it's a lumbar radiculopathy and it's affecting, your sciatic nerve, right? That's can be secondarily related to that that lumbar area of degeneration. Okay. So it's very important to understand that radiculopathy and peripheral neuropathy are two separate things. Okay. They can affect the nerve. Both of them can affect the nerve, but they affect the nerve differently. So peripheral neuropathy, right, is an issue that affects the nerve from a peripheral origin. And so what does that mean? That means that if I take this pen right here, okay, and I stab myself in the arm, I can disrupt the nerve in my arm peripherally. So I'm going to cause myself to have some I can cause myself to have some nerve issues in my arm due to a peripheral, okay, cause. Okay. That can also be, and I don't want to get too far into the peripheral neuropathy because we can do a video on that at a later date. But like you can have diabetic peripheral neuropathy and other types of peripheral neuropathy that mean that the nerve at the peripheral on the outside, right, starts to get affected due to whatever the cause, whether it be a mechanical disruption, the blood vessels surrounding the tissue are not feeding the tissue properly, or whatever. Okay. But radiculopathy is when you have some type of nerve dysfunction coming from the level of the spine. So, right. So we've got like nerve root dysfunction, um, a pinched nerve, something something like that coming from the spinal column itself. Okay. So you can have numbness, physical weakness, tingling, um, muscle spasms surrounding that area if there's some dysfunction. So the cervical radiculopathy is going to come from the neck or the cervical spine. Okay. And that's generally you're going to have symptoms. You can have symptoms in your upper extremities. Okay. Thoracic radiculopathy is when a nerve in the upper back is pinched. And you can have some of those symptoms in the chest or torso area. Okay. And then the lumbar radiculopathy is very common, and it can cause symptoms in the hips and the legs. It can also cause incontinence. It can cause problems with the groin area. Like I said, that's where I see it the most, is in the lumbar radiculopathy that's causing that lower extremity dysfunction. Okay. The upper extremity also happens quite frequently. Okay. And then we see people go in for treatment. They go in and they get things like cervical traction. And so what they do when they put you in traction, let's say you get neck traction, they put you in a thing and they kind of try to distract your neck up like this. So they get that nerve root they're trying to get stuff off your nerve root. Or they're trying to get things calmed down in there, right? You can get steroids injected in there to calm things down. There's a million different, you can get surgeries there. You can get a fusion. There's all kinds of things they can do to help. And sometimes it can just get better on its own, depending on the severity, right? So I think one of the key things is for you guys to understand that peripheral neuropathy and radiculopathy are two different things. Okay. So it's like a hose, right? I always explain it like this. So if the water stops working on a hose, does it stop working because I kinked the hose? That would be like a peripheral neuropathy. I kinked it, it's not working. Or I go turn the faucet off, right? That would, in my mind, be like a radiculopathy, right? It's where the water's not working anymore. What's causing the dysfunction of that hose? Is it because I kinked it, or is it because I turned the spigot off? So both things are affecting the hose, right? Because water's not coming through it, but it's two different places. So like peripheral neuropathy and radiculopathy, peripheral neuropathy is the downstream part where something's disrupting that nerve downstream. Radiculopathy is at the level of the spine, there's a problem, right? So for example, if you've got you know, peripheral neuropathy in the upper extremities and your carpal tunnel is all pinched off, that's probably not coming from your neck. Okay. But the median nerve that goes through your wrist can also be affected if you've got some kind of radiculopathy. They both affect the median nerve, just like the sciatic nerve. Okay. Something from the lumbar spine could be affecting that sciatic nerve. But also, if I stab you in the back of your thigh, your sciatic nerve is going to be, you're going to be having sciatica, right? You're going to be having some sciatic dysfunction. You could be, okay? But I'm not going to stab you in the back of the thigh. So we'll probably be okay today. Whew. So in all of those nerves, again, I'm not a VSO or a credit claims agent or an attorney. So you're probably going to want to talk to one of them about those ratings, but those ratings all depend on the nerve dysfunction itself and the severity. Okay. So you guys can look that up in the 38 Code of Federal Regulation. And it's important to know that you can be rated for the specific nerves and which side. So you can get a sciatic nerve and a femoral nerve on the left side and the right side. So if you're experiencing numbness and tingling and if you're service connected for your low back, for degenerative disc disease or some other thing like that, if you're service connected for that and you're experiencing radiculopathy, get your butt into the doctor and explain what's going on. And they may run A, because they're going to take care of you. Okay. That's something they can help you with. And then B, if it's something that's causing a dysfunction or a disability, you can be rated for that. Right. So I really love talking about radiculopathy and peripheral neuropathy. I think these are two things that veterans get super confused on, but they're actually pretty straightforward. So I hope this was super helpful to you guys. And yeah, hit me up if you guys have any questions. Please like and subscribe, and I'll see you guys next Monday. Thanks a lot.